Hello, this is a video lesson on infection control. Microorganism is a microscopic organism, and those of medical interest include bacteria, viruses, fungi, and protozoa. An infection is an invasion and multiplication of microorganisms in body tissues. A pathogen is a disease-producing microorganism. Normal flora is referred to as the microorganisms that are found in regions of the body that are exposed to the external environment, such as the skin, GI system, genitourinary system, and respiratory system. Potentially harmful bacteria such as Staphylococci and Streptococci are harbored in the nasopharynx of almost every healthy person. When we are healthy, the relationship between the host and the microbe is either beneficial or neutral. But when this person is compromised, the microbe seizes the opportunity to flourish and is harmful. There are 4 factors involved in the spread of diseases. Each is considered a link in the chain, and each link is connected to the next to form a ring. If at any point in the infection the chain is broken, the cycle cannot continue and infection will cease. For infections to be transmitted, there must be a host, an infectious microorganism, a mode of transmission, and a reservoir. The first item in the chain is the human host. Humans provide a favorable host environment for the growth of many microbes because of the abundance of organic nutrients and metabolites found within the human body. Each region or organ of the body offers a different temperature, pH, or body fluid for the microbial growth to occur. Infectious microorganisms include bacteria, viruses, fungi, and protozoa. Bacteria are microscopic, single-celled organisms with a simple internal organization. Bacillus and Clostridium are of medical importance, and some examples include streptococcal pharyngitis, such as strep throat, and Clostridium botulinum infection, which is food poisoning. Viruses are much simpler in form compared with bacteria or animal cells. Viruses are neither prokaryotic or eukaryotic. They are considered obligate intracellular parasites. Viruses cannot live outside as living cells. They lack the components necessary for their own survival because of their inability to synthesize specific required proteins. Common viral diseases in humans include the common cold caused by the rhinovirus, infectious mononucleosis caused by the Epstein-Barr virus, and warts caused by the papilloma virus. Fungi can be macroscopic, as in the case of mushrooms and puffballs, or microscopic, as in yeast and molds. They are eukaryotic organisms with a nucleus and are membrane-bound organelles. There are 4 different classifications of fungi, and the first include superficial infections, where they cause a discoloration of the skin. Second are the cutaneous infections, which involve the keratinized tissues of the hair, nails, and skin. An example would be ringworm or athlete's foot. The third type is a subcutaneous fungal infection that enters the human host as a result of trauma to the skin. And the fourth is an example of systemic infection that enters the circulatory and lymphatic infections and may be fatal. Protozoa are unicellular organisms that are neither plants nor animals. They are distinguished from the bacteria by their greater size and by the fact that they do not possess a cell wall. Typical infections of this type are Trichomonas vaginalis infection, which is a STD that affects both male and female hosts, and Plasmodium vivax infection, which is also referred to as malaria. The mode of transmission is the route by which the organism is going to find its way to the susceptible host, and there are 6 main routes of transmission. The first we'll consider is direct contact, and this means that the host has been touched by an infected person, and the organisms are placed in the direct contact with susceptible tissue. Examples include syphilis, HIV, staphylococcal, and streptococcal diseases. Indirect contact refers to where the host is indirectly touched by an infected person. meaning that there is a fomite, and that would be an inanimate object that's been in contact with a pathogenic organism. Fomites might include a urinary catheter. Others could include the X-ray table, a vertical bucky, image receptor, positioning sponge, or perhaps contaminated gloves. A vehicle, otherwise referred to as a common vehicle, is any medium that transports microorganisms. Examples include contaminated food, water, medication, or blood. A vector is an arthropod in whose body an infectious organism develops or multiplies, becoming infective to a new host. The bite of an infected insect can transmit diseases to humans. Examples of vectors include mosquitoes that transmit malaria, fleas that carry bubonic plague, and ticks that spread Lyme disease or Rocky Mountain spotted fever. The droplet transmission often refers to an infectious organism coughs, sneezes, speaks, or sings in the vicinity of a susceptible host. Droplet transmission involves the contact of the mucous membranes of the eyes, nose, or throat of a susceptible person with large droplets greater than 5 micrometers containing microorganisms. These particles do not remain suspended in the air and only travel short distances, usually 3 feet or less. Examples of infections that are transmitted via droplet contamination include influenza, meningitis, diphtheria, pertussis, and streptococcal pneumonia. Airborne transmission occurs from dust that contains spores or droplet nuclei. Droplet nuclei are defined as particles of evaporated droplets containing microorganisms that measure 5 microns or smaller. They can remain suspended in the air for long periods. These particles may be dispersed by air currents and may be inhaled by a susceptible host. Special air handling and ventilation are required to prevent airborne transmission of these infected particles. Examples are tuberculosis, rubella, and the varicella viruses. A reservoir is a site where an infectious organism can remain alive and from which transmission can occur. A person who serves as a reservoir is called a carrier. A carrier is an infected person who does not display the disease symptoms. An example of a person who did this in the past was Typhoid Mary. Animals, insects, and inanimate objects or fomites can also serve as reservoirs. Healthcare-associated infections, or HAIs, are infections that people acquire while they are receiving treatment for another condition while in a healthcare setting. These infections are also known as nosocomial infections. The majority of HAIs include urinary tract infections, surgical site infections, bloodstream infections, and pneumonia. On the other hand, iatrogenic infections is an infection that is a result of an intervention with a physician. This type of infection is strictly limited to the physician, whether he or she is in the hospital or not. Bloodborne pathogens are disease-causing microorganisms that may be present in the human blood. 2 bloodborne pathogens are of concern in the hospital setting and include HIV and HBV. HIV stands for the Human Immunodeficiency Virus, and it's so named because of its destruction of an individual's immune system. HIV is the bloodborne virus that causes AIDS. The AIDS virus is not acquired by casual contact. Touching or shaking hands, eating food prepared by an infected person, and contact with drinking fountains, telephones, toilets, or other surfaces does not result in transmission of HIV. The routes of transmission are through sexual contact, contaminated blood or needles, fluids containing blood, or from mother to fetus via the placenta. Infection can also be transmitted to infants through breast milk. The hepatitis B virus is more infectious than hepatitis C. Needle stick injuries are the most efficient method of transmitting the hepatitis B virus, but another mode is through non-intact skin contact with infected blood on environmental surfaces. Hepatitis B virus has been demonstrated to survive in dried blood on environmental surfaces for at least a week. That means that you can contract hepatitis B virus if you have an open wound and touch a contaminated surface. Asepsis refers to freedom from infection and can be divided into surgical and medical asepsis. Surgical asepsis is the procedure used to prevent contamination of microbes and endospores before, during, and after surgery using sterile technique. Sterilization refers to the absolute killing of all life forms. If proper sterilization techniques are used, the probability of infection is theoretically zero. Medical asepsis involves a reduction in the numbers of infectious agents, which in turn decreases the probability of infection, but does not necessarily reduce it to zero. A disinfectant is a chemical that alters the environment available to a microbe. It can refer to either the inactivation or inhibition of microbial growth. It may not entail the removal of bacterial endospores. An antiseptic refers to a disinfectant that is applied topically. A bacteriostatic agent stops bacterial growth, where a bactericidal agent causes cell killing. Examples of chemical disinfectants common in the radiology department include the halogens chlorine and iodine. Chlorine is found in bleach. Because it is such a strong oxidizing agent, bleach is ordinarily used on inanimate objects. Iodine is used as the antiseptic in betadine and Surgidine and is used in conjunction with alcohol swabbing. Another antiseptic that can be used is hydrogen peroxide and is typically used in deep wounds. Sterilization is the absolute killing of all life forms. There are many different physical methods used to accomplish this, and they include heat, moist heat, pasteurization, freezing, and UV light. Moist heat involves the idea of using steam under pressure, and this is accomplished in a device known as an autoclave. Contaminated linens. Objects or linens soiled with body secretions or excretions are considered contaminated and may serve as fomites even when no stains are available. Any linens that are used by patients should be handled as little as possible. But no matter of the degree of contamination, the linen would be placed in a plastic bag and then placed in a laundry bag. Contaminated bandages and dressings or any other objects contaminated with blood or body fluids must be placed directly into red plastic biohazard bags, which are sealed and discarded. Contaminated needles or used needles are placed in a special container called a Sharps container that is designed to receive the syringe without recapping it. There are some safer medical objects that are available. Some include a sheath that slides forward to shield the contaminated needle, and others have a retractable needle. The healthcare worker can retract the needle into the syringe and then discard it. Before sending specimens to the laboratory, place them in clean containers with secure caps and slip them inside a plastic bag labeled with the biohazard symbol. In 1996, the CDC recommended a new system that synthesized features of both universal precautions and body substance precautions. This has been used in many years and it's been used as an infection control system in all types of institutions. Standard precautions apply to all types of surfaces, fluids, etc., except for sweat. The key to effective protection using precautions is using a consistent approach to all contact with all body substances of all patients at all times. There's no reason to question whether one person has an infectious disease versus another. The idea is to protect yourself. Standard precautions include the care for all patients and includes any type of possibility of encountering blood, body fluids, excretions, and contaminated items. The first important thing is to look at is washing hands before and after patient care, and that's regardless of whether gloves were worn. Secondly is to wear gloves if needed. Third is to wear a mask and eyewear if needed. Fourth is to wear a gown if needed. And finally, to take care to prevent injuries with needles. To go into a little bit more detail, hand washing is the most important means of preventing the spread of infection. It's so important to wash your hands before and after procedures. If there's any possibility of contact with body fluids or any type of other item, then it's important to wear gloves. Personal protective equipment is important to wear if you're going to encounter any type of interaction with body fluids, blood secretions, excretions, or any of those items. Needle recapping just shouldn't be done. It should be avoided if at all possible, but if it must be, the one-handed scoop technique should be used. All sharps, of course, must be placed in a sharps container. And finally, paper towels can be used to blot a spill and then discarded into designated medical waste containers. As far as the cleaning agent, hospitals would have their own hospital-grade disinfectants, or a bleached water solution of a 1 to 10 ratio can be used too. At the same time that standard precautions came about in the 1990s, we had transmission-based precautions as well. And these are the CDC's recommendation for isolating patients with contagious diseases. We are to use these precautions in conjunction with standard precautions. Airborne precautions should be used in addition to standard precautions include number 1, considerations of patient placement, number 2, the respiratory infection, and number 3 is the patient transport. These precautions must be used for patients with pathologic conditions such as tuberculosis, varicella, and rubella, which is also referred to as measles. The big difference between airborne and droplet precautions are number 1, the type of respiratory infection, which is the mask. A surgical mask can be used versus a special respirator. And secondly, when you're working within 3 feet of the patient or when entering a room is when a mask should be worn. That patient's room door can be even left open. The third consideration again is patient transport. Now the types of pathologic conditions for which we must use droplet precautions include rubella, mumps, influenza, and the adenovirus. Contact precautions must also be used in addition to standard precautions and include a private room if possible. Secondly, wearing gloves. Third, washing hands immediately after glove removal. Wearing a gown, limiting transport, and when possible, dedicate use of non-critical patient care equipment to a single patient. Examples of conditions that require contact precautions include MRSA, hepatitis A, impetigo, varicella, and varicella zoster. Radiography of isolation patients. Radiography of the isolation patient requires 2 people, preferably 2 radiographers. The clean member handles the equipment and has no direct contact with the patient, the bed, or any items the patient may have touched. This radiographer is the only one who handles the X-ray machine and the uncovered image receptor or receptors. The dirty member positions the patient. The dirty member of the team must wear the PPE required and enclose the image receptor in a protective cover. Now, as you normally would, you would greet the patient, make your introductions, and explain the procedure. Patients in isolation often feel rejected or untouchable, but many times you can alleviate these feelings by expressing a friendly interest in the patient and avoiding any display of fear or revulsion. The dirty member of the team places the image receptor appropriately, making certain the exposure side is toward the X-ray tube. In the meantime, we can't see this person, but the clean teammate positions the machine, sets the controls, and makes the exposure. After the exposure is taken, image receptor is retrieved. At that point, the protective cover is partially removed, and it's offered to the clean teammate with the edge exposed. The contaminated cover is placed in the proper container and image receptor stored in the machine compartment. That image receptor can be cleaned with a disinfectant. It's important then to clean the mobile X-ray unit thoroughly before it is taken back to the radiology department. In fact, it should be disinfected. When it's necessary to transport an infected patient to the radiology department, the first step is to identify the isolation category involved and prepare for the examination accordingly. Cover the stretcher wheelchair with a sheet and then with another sheet or cotton blanket. Depending on the isolation category, you may need to protect yourself in your uniform by wearing a glove, gown, and mask. The patient with respiratory disease should wear a mask while being transported. When talking about protecting a patient with compromise resistant, this is where a patient is in isolation perhaps because they are immunocompromised. The precautions used for a compromised patient require that the equipment be cleaned before entering the patient's room. Hand hygiene is required before touching the patient to bed or articles handled by the patient. Masks, caps, or gowns and gloves may provide additional protection for the patient at risk. In extreme cases, sterile gowns and gloves may be worn in the same manner used for a surgical procedure. Under the system of protective precautions, the radiographer who positions the patient is the clean member of the team. Wearing the proper protective clothing, this radiographer avoids contact with the uncovered image receptor, the X-ray machine, and other potentially contaminated articles. To cover the IR properly, this radiographer folds back the edges of the sterile cassette covers and opens it while the second radiographer, in this case the dirty one, places the image receptor inside. Care must be taken not to contaminate the outside of the cover. The clean radiographer touches only the patient, the bed, the covered IR, and the clean or sterile items, where the dirty radiographer touches only the equipment. These rules are the exact opposites of those used that we talked about for isolation technique. In this video lesson, we've examined items related to infection as well as standard and transmission-based precautions. And we concluded with considering how to work with isolation and compromised patients. Have a great day!